is Adriana. I'm a nursing student from Kilroy College. Can you tell me your name and date of birth, please?
Jennifer Aniston, February 1976.
Okay. Miss Aniston, do you have any allergies?
No.
Okay. So what we will be doing today is I will be doing a head to neck assessment, and I will also be doing your vital signs. We will be doing your respirations, your heart rate, your blood pressure, your temperature, and your O2 saturation, okay? Are you in a comfortable position?
Yes.
Okay, so the first thing that I will be starting is I will be doing her general appearance portion of the test. My patient does seem well put together. Her hygiene looks normal. She is appropriately dressed for the weather. Her skin tone also matches her race and her ethnicity. Miss Aniston, can you please smile for me? Can you make a frown? Make a mad face? Okay. Can you tell me where you are right now?
Clinic.
Okay, can you tell me what the day of the week it is today?
Wednesday.
Okay. What have you eaten in the last 24 hours?
Eggs and toast.
Okay. So my patient is responding, so she's hearing me, and her speech is also normal. Her mood is also calm. She seems calm and collected. So now moving on to the measurements. Can you tell me your height and your weight?
5'5" and 170.
5'5" and 170 pounds. On a pain scale between 0 and 10, 0 being no pain and 10 being the worst pain you've ever felt, what level would you measure your pain?
0.
Okay. So moving on to the vital signs, I will be starting with your pulse. So I will be palpitating her pulse and the radial pulse. Okay. The pulse does seem normal and the amplitude is +2, and now I will be taking her rate. Okay. So her rate is 86 beats per minute. Her rhythm is normal, and the amplitude, like I said, is +2. Okay, so now moving on to the respiration. Miss Anderson, if you could please place your arm over your chest and just relax for me. So the respirations are 16 breaths per minute. Her depth is unlabored and her rhythm is even. Okay, Miss Anderson, now for the, we will be taking your blood pressure. I first will be palpitating for her brachial pulse. Okay. I am deflating the cup. And now I will be disinfecting my stethoscope. Okay, her blood pressure, it was 120/72. Okay, now we will be taking your oxygen saturation. Place the ox balls on her finger, and I will be taking your temperature. Have you had anything to eat or drink or smoke in the last 30 minutes?
No.
Okay. You could please open your mouth, lift up your tongue, and close your mouth. Beep beep. Okay. Her temperature shows to be 98.6, and her oxygen level is at 99. And I am disinfecting the thermometer. Okay, so now moving on to the head to neck, I will be putting on gloves. And first I will be inspecting her scalp with my eyes only. Okay, now I will be palpitating her scalp with my fingers. I do not notice any lumps or bumps, signs of infestations or lesions. I am removing my gloves. Now I will be looking at her face symmetry. It does look normal and symmetric. And to check the facial expressions again, Miss Aniston, can you please smile, frown, make a mad face? Okay. And now I will be palpitating for her sinuses. Okay, the sinuses do seem normal. I don't notice any abnormalities with her sinus. And now to move on to the ear portion of the assessment. Without my pen light, first I will be assessing the back of her ear. Now the ear canal, everything looks normal. And the other one seems normal as well. Now, Miss Aniston, we will be performing what's called an ear test. So you will be covering one ear with your hand, and I will whisper 3 words, and you will repeat them back to me, okay?
Okay.
If you could please just cover one ear.
Red, yellow, black.
Good. Now the other one.
White, green, gray.
Good. Okay. Now moving on to the eye portion of the head to neck assessment. If you could please look straight ahead and just tell me when you can no longer see my pen.
Can't.
Okay, now to do the other side.
Can't.
Okay. Now I will be looking at the pupil structure. The pupil, they seem normal, symmetrical, round. And the size of her pupils are a 5. Okay, now we're going to be doing the Carnot test. If you could please look at my pen and only follow my pen with your eyes. Okay, now we will be performing the eye test with the pen line. So just look straight ahead. Okay. Pupils are even, round, and reactive to light. Now look at my pen and just follow it. Once again. Okay. And the eyes do accommodate. Now to move on to the nose portion of the test. Her nose does look symmetrical. If you could please tilt your head back. And there are no abnormalities in her nostrils. Now her mouth. If you could stick out your tongue and say ah. Okay. Now to move on to the neck portion of the test, I am going to be palpitating for her lymph nodes. Okay, everything seems normal. If you could please turn to your right, your left, and then to your right, and then your head in circles. Okay, good. I'm going to place my hand on your cheek and you just push against it. Okay, now the other one. Okay, I'm going to push down on your shoulders now, and then you just push up against my hands. Okay, if you could please extend your neck to one side. The jugular vein seems normal. Now the other side. Jugular vein normal on the other side. Now we'll be feeling for her carotid pulse. Okay. Are you in a comfortable position?
Yes.
Okay. I am performing hand hygiene, and I have documented my findings.